Hi, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. So first, our weekly kudos to businesses in the community. And today, out to Duckett's Produce, nicely done, Bosu's, nicely done, and Blue Mountain Chiropractic, nicely done. Thanks to the Chamber of Commerce for recognizing businesses doing their part to protect health and preserve the economy. So against the backdrop of accelerating infections across more than 20 states, increasing hospitalizations and fatalities, and the highest single daily case count in the United States since late April, let's look at what's happening the past week here in Haywood County and western North Carolina. So, after a ramp up in case counts in late May, early June here, we have seen our cases slow considerably for the past couple weeks. And this continued through the early part of this week, but now appears to be changing. There have been 13 additional new cases since last week, 5 reported alone today. And we are now at 82 cases total. For perspective, there were 55 at the beginning of June, 5 near the end of April. The percentage of positive tests among all those tested had been around 5% in May. Now, overall, it's dropped to 3.8%, reflecting that decreased case count early in June. 2 weeks ago, for just that week, it was at 1.5%. Now, this week, it's at 2.7, again reflecting the increased rate in new cases. So, thumbs neutral at best, maybe wavering a little bit. The doubling rate had gotten down to a worrisome level of around 4.5 days in late May. It's now lengthened way out to 10 days, so that's good. And hospitalizations, there was a slight uptrend in the first part of June in people hospitalized with concerning symptoms, but now that's back down, and that's good for hospital capacity. That's a thumbs up. So here's what we are seeing. Right now, we remain in Haywood County in a good space, certainly relative to the rest of North Carolina and the country, but with worrisome clouds on the horizon. The groups of cases we identified from late May, early June have mostly all been resolved, and that's good news. But new groupings are emerging, new index cases who are spawning new groups of their own. The number of people in isolation has been steady over the past couple of weeks, but now has inched up a bit to 17. And there are now, as of today, 19 in quarantine, but with today's cases, that number will surely go up as we trace additional contacts. I'm expecting somewhere around 30 or more. There are also around 85 pending test results, and based on the current percentages, we can expect an additional 3 to 4 cases to result from these. In addition, COVID-like illness, which is a possible early warning signal, is steadily up in North Carolina. In Haywood County, it was a slight uptick at the end of May. It went down a bit, but now again, people seeking care for suggestive symptoms has gone up this past week. So, if you put all that together, we may well be seeing the start of another rolling wave here. We'll just have to see. And to add to that concern, look around us. The R0, if you remember, is a measure of contagiousness and spread. In North Carolina, it continues to hover around 1, which is the crucial number. Above 1 indicates increasing spread. Below 1 indicates decreasing spread. But look at Georgia and Tennessee. They were hovering below 1. They're now up to 1.14. And what about South Carolina and Florida? Even more so, now both around 1.3. Each of those states reopened earlier, and more than we did. And despite our slower reopening, we have certainly been impacted as we travel there and others travel here. Across western North Carolina this week has seen an increase in cases across the board, anywhere between 10% for Buncombe, 20% for Haywood and Henderson, up to around 30% increased cases just this week for Macon, Jackson, and Swain. And over in East Tennessee, Cocke County, Hamlin, Jefferson, and Sevier counties are also seeing accelerating numbers of new cases. The age distribution of cases continues to move younger across the state and western North Carolina, as you might expect with reopening. Increasing cases with increasing contact between people, sure, but relaxing their vigilance or increased resistance to and reluctance and outright refusal to follow public health recommendations. There was a story of 100 students from Ohio who went to Myrtle Beach. At least 17 were infected and returned home to a county in Ohio. That county had worked hard to get its infection rate down to nearly 0. By the way, those are counted as Ohio cases, not Myrtle Beach cases, because that's where those people live. So pay attention to places where you want to go and to the potential exposure you might have there. And if you still wonder whether the public health measures work, well, how about this? Look at the European Union. Its 7 largest countries have a similar population to the United States. This week on Tuesday, they had 2,000 new cases. In the United States, we had 30,000. And that includes Italy, Spain, and France, all places so hard hit back in April. We don't all have to agree on everything to be able to agree on some things. And the answer is in. The public health measures work. So please think broadly. Think about yourself, but also think about others in those thoughts. A large majority of the contacts we see who become infected are from someone who is pre-symptomatic. It's not their fault, and it's not yours, unless you ignore what's happening right in front of your face. So share the need to protect each other. Your choices can have such a big impact on those around you. So be well, be careful, especially right now.